Hey there, are you looking for relief from knots in your neck and shoulder area? Are you suffering every day with tension and uncomfortable spots that you can press and it just zings pain up or down, or it just aches and burns by the end of the day? If you're trying to avoid taking pain medications for it and you don't want to have injections for this, or you're concerned that this is going to turn into a worse problem later on and you might need surgery for it, I've got some help for you. I'm going to cover with you today the top 8 ways to relieve neck and shoulder knots. Now, my name is Dr. David Midoff. I'm a specialist physical therapist from Paso Manual Physical Therapy, and I've spent years helping people out with knots in their neck and shoulder area. Almost always, over 9 out of 10 times, it's a fixable problem, does not need surgery. You don't need to rely on injections or taking pain medications all day. In fact, I highly discourage it if you can, so that you can save your organs and be healthy for the long term. And it's okay if you've got a desk job. A lot of people that have desk jobs end up getting these knots in their neck and shoulder area. You know, if they're writing at a desk or using a computer, they think that it's their job that's causing the problem. And to a degree, it might be a factor, but it's okay to have a desk job. You can still fix this problem despite having a desk job, and you can continue working at your job for the long term as long as you do the right things. Now let me go into with you the top 8 ways to relieve neck and shoulder knots. Number 1, if you're dealing with a knot right now, if you feel one in your neck or somewhere in the shoulder area, on the back of the shoulder, the number 1 thing you can do is go lie down. More often than not, the problem is related to gravity pushing down on your neck joints and your shoulders, and if you can get from upright, whether you're sitting or standing, to lying down, a lot of times it begins to relieve the pressure and you can find some relief. Many people don't realize this. They might get a taste of it if they sit in a chair or recliner and kind of lean back halfway. They'll get some benefit out of that. But if you go lie down flat, and you can put a pillow behind you, just get comfortable, but you got to be lying down flat, that usually provides relief over time. That can free up the joints, the tissues, the muscles, the nerves, all that stuff that is getting aggravated. You can take pressure off of it and skip taking pain medication for that time. Tip number 2, use armrests. Now think about this. If you're working at a desk and you have a computer chair, or if you're driving a lot, there's usually armrests around you, or the console in a car, the door has an armrest on it. At home, if you're watching TV, you might be sitting in a couch or recliner that has armrests as well. Like I said earlier, gravity is pushing down on all your joints and your neck and shoulders, and that contributes to the knots. If you can use the armrest enough to where you shove them up so that it shoves your shoulder up, you might need to put pillows under there, a rolled up towel, or if you have adjustable armrests wherever you're sitting, adjust the armrest so that it's at its highest setting so that it kind of raises your shoulders up. It takes some of the pressure off that gravity is pushing down on your shoulders. So that can provide you some relief and extend your time sitting at work or driving before those knots really get burny and achy. Tip number 3, using ice and heat can be beneficial. Now, I've gotten mixed results with telling clients, and truthfully, the research, the science out there on whether to use ice or heat is so mixed. There isn't a clear indication on whether you should use heat or ice. What I tell people all the time is try both and see which one works better for you. And you might even need the third option of alternating heat and ice. Some people do really well with that. Either way, I recommend people start out with heat. That tends to help the knots a bit better. Some people end up not liking heat and they'll try out ice. That's fine. But you can get any sort of hot pack that they sell at the store. You can get these at Walmart, Walgreens, CVS, grocery stores. A lot of them can be used for heat or ice, or there are some that are dedicated for heat and some that are dedicated for cold. Whichever one you want to use, put that around your neck or shoulder area where you feel the knot hurting the worst, and that can stave off the pain for a short period of time, which might allow you to avoid taking that pain medication and feeling a little bit better by the end of the day. So try that out. Tip number 4, massage. Massage is fantastic at relieving tight muscles. Now you do have to be careful with this, because if your problem is more nerve driven than it is muscle driven, massage may not be the best option for you. But a simple way that you can test this theory out on yourself is just get in there and rub around the areas. Now if you feel a hard lump that you think might be the source of your knot, the problem that you're dealing with, it could be a bone that's sticking out. Your ribs are right up here above your shoulder blade and above your collarbone. Your first and your second rib are up there, and sometimes those ribs can shift out of place and create a knot or a hard lump in the area. If that's the case, you might need some specialist help, like from a physical therapist, to get that rib to settle down. It's very fixable in most people. But if it's more muscular, it'll be softer, and it should be relieved if you rub it gently for 5 to 10 minutes. It doesn't take long. 5 to 10 minutes is plenty of time. Here in the clinic, realistically, we'll do massage techniques on knots for a minute or two. We're a little more specific with how we do it, but a minute or two is adequate to get the muscle to calm down, and that can provide quite a bit of relief. Now, if you're looking to get a full body massage or have somebody focus on your neck and shoulders for a more longer period of time, like a 15 or 30-minute massage, that's something that we can do for you here in the clinic. Or if you have your favorite massage therapist that you like to go see, then I recommend you try that out as well, so that you're not having to take pain medication today and suffer through this neck and shoulder problem. So try out massage. That could be a good way to get some still short-term relief, but it might last a little bit longer than, say, the hot pack or the ice pack. Tip number 5, if you're a desk worker, if you use the computer a lot, take screen breaks. And you know, even with mobile phones and mobile devices, tablets, that kind of thing, having a screen in front of you, whether you're holding it or it's on a desk, holding your head in the same position for more than 15 to 20 minutes at a time is usually detrimental to the neck and shoulder joints, especially over days, weeks, and months of doing that. So I'm not saying it's not possible for you to have a desk job for the rest of your career and have a healthy neck and shoulders. You can. What I recommend is take breaks. All our desk clients, all our attorneys, our people in the medical field are always on the computer. We tell them as well. Our teachers, our people. Right now we're in a special time with certain illnesses going around, so a lot of people are more at home, working from home. They've got to spend a lot of time in front of the computer. So what we're telling our clients that are coming in for neck and shoulder problems and knots associated with that is put timers around you. Put a timer on your phone, on your smartwatch, on your computer. Your good old-fashioned kitchen timer works well, on your microwave. Have something that reminds you to get up and move, turn your head, move your shoulders, do some sort of exercise that you enjoy doing, or one that you know is beneficial for you, and break up the extended sitting time in front of a screen. So take breaks from the screen so that you can get some movement. That tremendously helps out neck and shoulder problems over the long term. It will reduce the intensity of the knots, and over the long term truly begin to correct the problem. There's a little bit more to it than that, but that's the way to kickstart it. Tip number 6, exercise. And I'm going to call this light exercise because tip number 7 is going to be related to it, but it's a little bit different. Light exercises is one of the best places to start fixing knots in your neck and shoulder. Now, it may be painful, especially if those knots in your neck and shoulders are active right now. They're hurting you, they're achy and burny. It may be painful to move around your shoulders or raise your arms up or go to the gym if it's the end of the day and you like to work out at the end of the day and you've been at your desk all day long and those knots have just gotten worse and worse. It may be a little uncomfortable, so start out with light exercise. Now, tip number 7, once you've done light exercise for a bit and your neck and shoulder problems have calmed down, then go into the more heavy exercise. And when I say heavy, I don't mean heavy with the weights necessarily. It might, but it just means a little bit more intense, a little bit more aggressive than the light version of what you were doing. Now, as far as the specific exercises, there's so many options for you, and it really depends on what's going on. That leads me into tip number 8. Get help from a specialist. Somebody like a specialist physical therapist that sees neck and shoulder knots all the time speeds this whole process up tremendously. And we're in the best position to help you find out what's going to solve this problem for the long term so that you're never having to deal with injections or pain medications, and most importantly, so that you're not having to face a surgeon someday for something that you could have fixed right now before it got really bad. A specialist physical therapist can guide you on the exercises to do. We have to test out muscles and look at the joints, look at the nerves, look at all the factors involved in that are contributing to your knots in your neck and shoulder, so that we can give you the precise exercises to begin to do on your own. and also make it easier, make it hard, or move it along from easy to hard as you get better. So getting expert help really speeds up the whole thing. Hey, thanks for watching this. I hope that it was helpful for you. If you want to learn more about neck and shoulder tips and advice, hit subscribe right around me here and click the little bell to get notifications, and also go to our playlist about neck and shoulder videos so that you can see way more videos about neck and shoulder problems. I hope you have a wonderful day. Bye-bye.